So good morning, everybody, and welcome to another ACA training session. My name Al Castellanos with Premier Insurance Contracts, your digital marketing, field marketing organization. And we have a lot of material to cover with you today. This is what now the fourth session that we're having in all this training. By the way, we're going to be having all these in a package that we're going to put on the Amidim platform. So that you can go back and look and study and repeat as many times as you want all aspects of everything that we have been covering. We have kept this to 1 hour sessions because if not, it's too much time and too much information for you guys. So you can always go back and check it out under the Amidim platform. By next week, we should have the modules that we already have recorded, and then we will continue adding to those modules. So let's get started right away. We have, again, a lot of information. This was the original agenda, 4 sessions. We have covered most of it, and today we're going to talk a little bit about quote engines. So we're going to be talking about quote engines here, and we're going to also be talking about, we're going to retake the concept of health on demand, and we're going to mix a little bit of sessions 3 and 4 today. But first, what I want to do, because of the training with quote engines that we want to do a very fast review of what we have covered so far, because today we're going to start the process of integrating everything, and we're going to apply everything we have learned. So let me go through that process right away. Again, very important, at the PIC website, at the Prinsuco website, we have a lot of resources for you. Make sure you learn how to use the website and make sure you use all the resources that we have there available for you. A lot of good information. Many of the materials that we show you in all these trainings, you can access here directly. So make sure you start using the Prinsuco, the PIC resources that we put at your disposition. So very important. Again, the training, this is for the Affordable Care Act for 2021. And very important, the concept of total financial governance. Remember, everybody that you meet is full of financial needs. They have all these different financial needs. And right now, basically, we're focusing on helping them with one of their needs, their need for health insurance. So make sure that when you are interacting with these individuals, you always keep in mind the fact that you want to start a relationship or you want to sustain a relationship over time with these people. It's not just a one-time sale of an ACA plan. That's not how you want to focus. You want to make sure that you make a good impression, you introduce yourself properly so that you can go back to these people and help them with many other of the financial needs that they might have. And we have a lot of training for that. We're not going to touch any more on that today, but remember that the concept of total financial governance tells you that everybody is full of financial needs, and you need to make sure that you help them with multiple needs and not just with one need. So that's a very important thing. You need to be licensed. And by the way, make sure you show them your license. It gives you credibility up front. So you need to be licensed and you need to be certified, and make sure you show them your certifications. Again, that gives you credibility. And also, if you have any type of recognition from the marketplace or any type of accomplishment, make sure you show them that. We covered that in previous sessions. And we talked about the world of subsidies and the world of no subsidies, and how people might be in one of these worlds and when it can be important to be in one of the worlds versus the other world. So we cover that. And then we talked about all the different products that you can offer to people based on the fact that they belong to the world of no subsidies or they belong to the world of subsidies, and how you can have somebody in the world of subsidies that might not want a subsidy, or how you could have somebody in the world of subsidies that you want to give them the subsidy. So we covered all of that about all the different products and when one product is convenient and when the other product is convenient. And then we spoke about the power of the essential health benefits and how they give somebody a very comprehensive package, but at the same time, they give them an expensive package. So that's where the other products come handy, because in some instances, this is impractical. For example, a couple that is 64 years old, and if you have to include in the package maternity care, which they're not going to be using, then that makes this product not efficient for that couple. So then there you would have a scenario where you will want to go to another type of product. So again, you need to make sure that you cover with the client all the characteristics of the essential health benefits. Then we talked about the metallic products, and today we're going to touch a lot on the metallic products. Remember the 4 different types of metallic products: the bronze, the silver, the gold, and the platinum, and we went about the cost sharing associated with each one of them. So we spoke about that. And then we spoke about the networks, and we mentioned how we have the EPOs and the HMOs, and basically we don't have PPOs under the world of subsidies. When you go into the world of subsidies, there are no PPOs available there, and today we're going to see it when we look into the quote engine. So basically you have EPOs, exclusive provider organizations, and HMOs, health maintenance organizations, and you need to understand the difference between all these networks and the impact that they have on the client. So we went through that, and make sure that you watch the training that we did on networks in previous classes. Then we spoke about the cost structure of a health insurance plan, and this is a fundamental element of everything that we do. We mentioned the fact that any health insurance plan has 5 cost elements, and a lot of people have a tendency not to understand that, and not to explain that, and not to use that. Well, we have premiums, and we have deductibles, and we have coinsurance, and we have copayments, and we have the maximum out of pocket, which is basically the sum of columns 2, 3, and 4. And this is a very important element, because this is what helps people not to go bankrupt whenever they have a serious health situation. So we spoke a lot about the cost structure of a health insurance plan. This is a graphic that you can use. If you call one of our digital marketing coaches, they can personalize this for you with your digital brands, so you can use this. And then we talked about the cash flow structure in an ACA plan, and how you have different types of cash flows. This is a scenario of your basic traditional type of cash flow, and then you have this scenario here. And now that we have started seeing the products that are going to be offered for 2021, we're starting to see how everybody's basically moving along these lines here, and that makes everything much more easy for the cash flow from an individual's perspective, in terms of when they start interacting with their packages, with the product. Then it's easier on them in terms of how money, at what speed money comes out of their pocket. So we spoke a lot about the cash structure in an ACA plan. And then we spoke about how we can help people. We can help people in 2 different ways. We can help them with the premium through the advanced premium tax credit. And then we can help them with cost sharing reductions for items 2, 3, and 4, and 5. Okay, so we talked a little bit about that. And now we're going to see today some examples about that. And again, we mentioned what is the annual cost sharing limit for 2021. For an individual is $8,550, and for a family, $17,100. And this is the number you fight against. This is what you want to do, is you want to make sure that you reduce this exposure for an individual. And this is where you come in and you start using all your knowledge and all the information to try to get them to reduce this number by qualifying them to the proper plan. So this is a number that you always need to make sure you keep in mind, and that you know exactly what the 2021 annual cost sharing limit is, because again, it's all about reducing that number there. Then we talked about the federal poverty level chart, and we talked about the colors, and now today we're going to talk about it again. And we went about the 94th percentile, which is from 100 to 150% of FPL. And then we talked about the 87% help, which is up to 200% of FPL. And then we talked about the 73%, which is up to 250 of FPL. And then how people that are between 300 and 400 of FPL, they get help with their monthly premium, but they will not get help with cost sharing reductions. And then we mentioned the fact that in order for them to be able to get any type of help with cost sharing reductions, which is anything here on these green boxes here, you need to make sure that you enroll them into a silver plan. In order for them to get the cost sharing reduction help, which means this, that they qualify based on these parts of the graph here, you need to make sure you enroll them into a silver plan. And we're going to see that in a little while. Additionally, we spoke about the household size and then how that affects the level of help that they're going to be getting with the premium and the level of help that they're going to be getting for cost sharing reductions. Then we talked about Medicaid and the problems associated with that, and CHIP, and how people can go to CHIP and the tables. And we have links to the CHIP website from the Prinsuco website so that you can go there and even help people apply for CHIP if, when you're going through the enrollment process, it tells you that you need to do that. And we spoke about the area of conflict between the employer and the employee, and how that affects things, and how that is going to be even a bigger player this year. And we're going to get into that today even more. So we have the affordability concept between the employer and the employee mandates. And we went about health reimbursement arrangements, which is a big thing coming up for 2021. And we went about the different types and the concepts behind it and what important things you need to know about that. And then this is a very important number. The required contribution percentage, 9.78%. So we went and we did a couple of examples on that. And so we went through the calculation and we went through the tools and how, depending on where they land, if the recommendation is for them to accept the help that they're getting from their employer or not. So we went through all this process in previous sessions. And then we went into help on demand. And hopefully, if you did your homework by now, you should be already registered with help on demand. The importance of help on demand is that you're going to start getting some clients that are referred to you by the marketplace. And some agents say, well, they make me lose time. You know, I start talking to these people and I don't get anywhere. Well, I see it very differently. You know, this is an opportunity for you to train, for you to practice, for you to encounter the real situations that come up when you are talking to people on the marketplace. So just see it from the perspective that this is training for you. This is an opportunity for you to start confronting the different issues associated with the types of doubts and the type of questions that you're going to get when you talk to somebody. So from that perspective, it's a fantastic free training session that you're getting. But aside from that, you can end up enrolling some people. So again, help on demand, very important. So we went through the process of help on demand. Hopefully you are all registered by now with help on demand and how does it work. And I emphasize certain things. So, and that's what we basically finished on the last session. So let's get started with this session from this slide here. And this is how the actual landing page for the help on demand site looks. This is the actual help on demand landing page, and this is the address for that. So you go in there, make sure, hopefully you already went in there, and make sure that you complete your availability schedule. Very important, because if you start not showing up, if you say that you are available and you don't pick up the call, then it's going to go against you. So if you need to turn it off or anything, this is where you do that. This is how it looks. It takes a couple of days for this to happen. So that's why I couldn't show you this last week. So make sure you get started on that today if you have not started with help on demand. It's a fantastic way to train, and additionally, you can make some sales when doing that. So this is how the metrics go. And again, very important, the metrics, because you need to make sure these guys are really serious about you disposing of the lead. And disposing can mean, hey, this is not a good referral. That's valid. Okay, if it's somebody that you cannot help, you just say so, but you have to say so. Okay, so again, very important, the metrics, because they measure you based on these metrics. And if you are doing good, they keep sending you more. And if you start just dropping the ball and not following up and not disposing of them properly, well, guess what? They will stop sending you leads. Okay, so very important that you learn how to do the disposal and follow the metrics. In the training sessions, you go about, they really cover this thoroughly. So you can go through the whole process and see exactly how it works. Okay. Now let's talk a little bit about this document here, the Get Ready to Apply document. This is a document, it's in our website, and this is a document that I strongly recommend you that you download and that you have a lot of this. You can print some and you can send to people also in a PDF. This is a very important document to get people ready for that meeting that they're going to be having with you. Okay, so my recommendation is that anybody you talk to, give them this document. Ask them, hey, I'm going to send you a document to make sure that you get ready to apply or to re-enroll in your health insurance marketplace coverage for 2021. This is a fantastic way for you to get that conversation started, or you can make a phone call and tell them that you're going to send them this document in a PDF. This is a good way for you to get an update on their email, and you send them this document. And then you tell them that you're going, that for them to make sure to read the whole document. If they have any questions, they can call you about the document, and that you're going to be going over this document with them when you start the enrollment process. Everything in this document is absolutely important. And I know it's small. I just want to show you the document in general, but I'm going to now open this document, and I want to make sure that I covered a couple of things in this document with you. Because again, this document, it's very, very important. Now, we do have the link here. This link down here is live, so you click on it, it will take you there. So I'm going to do that. I might already have it open in the computer. So, but here we are, okay? And again, very important to make sure that you, and I don't know, maybe I should make it a little bit bigger here. I'm going to try to make it a little bit bigger so that we see it better. 1 second here. Okay, so I'm going to make it bigger. There we go. There we go. I don't want to make it too big there, but okay, anyway. But the important thing is that you have here, what do I need? So again, remember, this is them. Why you need this document, and do you have it ready? So this is an actual checklist, okay? And make sure you tell the client, hey, we're gonna need everything in this checklist. Everything in this checklist we're gonna need. And please, Mr. Client, read it. And therefore, number one, you're gonna learn about the process and learn about what we're gonna be doing, because this is very important, and you're gonna really learn a lot if you go through this document. And additionally, these are the things that we're going to be covering in our session, okay? So this will save you time if they are ready for you. Once they complete this document, your actual enrollment process is going to be easier, and you can focus on the things that are important. So again, let me go a little bit, over this document. There are certain things that I want you to make sure that we cover. Number one, information about everyone applying for coverage. So, Mr. Smith, we want information on everyone. So make sure you have all the information for everyone that we're going to be using or we're going to be applying for. Social Security numbers for everyone. Information about the professional helping you apply. Okay, so very important. Hey, I'm the person that is going to be helping you. Do you have somebody that was helping you before? That is very important, because as you all know, there are new rules now with the agent of record and all that, and there are opportunities for you to take over a client. So this is a good chance here of knowing exactly how they have been doing it and your opportunity to move them for them to become your client. Then if you are dealing with somebody that is an immigrant, make sure that there is a lot of wasted time here on the immigration document information, because in many instances, it's cumbersome, and it's some documents that are difficult. People normally don't have them handy. So make sure that you talk about the immigration documents, okay? Now, information on how they file for their taxes, very important. The employer and income information is very important here, because again, now we're gonna have issues associated, remember, with the area of conflict that we have between the employer mandate and the employee mandate. And now we're also going to have HRAs as another area of conflict. So we need to make sure that we don't run into a situation where we are going to have a problem, and that gets started. That the solution to that gets started by thoroughly talking about the employer and the income information for the individual. So make sure you talk about that. Then you talk about your best estimate of your household income. Very important that you go through the how you go about that estimate concept for next year, because remember that we're applying for coverage for next year. So we're talking about the future, and nobody knows, nobody can tell you in this world the exact amount of money that they're going to be making in 2021. So it's an estimate under any scenario. So make sure you go over that. And then if they do have any type of coverage at this time, so that's a good thing that you go over that. Remember, we have another document where you are actually putting all the information, populating all the information, and this is the time for you to find out exactly what is it that they had in the past, if they had an account with the marketplace or not, etc. And then we talk about the employer information. Remember how I mentioned how that was so important. And this is so very important because there is this tool called the Employer Coverage Tool, okay? And that is very important because these two parts here, the Employer Coverage Tool and the Health Reimbursement Arrangement HRA Notice, these two checklists, these two elements of the checklist down here, let me emphasize it differently here. So these last two, which are at the bottom of the last page, are the ones that are going to help you stay out of trouble with your client, in terms that we're going to know exactly if they have any type of coverage or proposal of coverage, because they might not have taken it, but if it was proposed to them, if they are eligible, that will make them, that will change things for them. So you need to make sure that you are really diligent in talking about these two elements down here to make sure that you are enrolling them in the right plan. But additionally, if you find out that they have a health reimbursement arrangement, an HRA, that's a huge opportunity that you just run into. Because remember, what is a health reimbursement arrangement? The employer, and we covered this in the past sessions, the employer is giving money to each one of the employees for them to go to the marketplace and buy their own plan. So you could try to see if you can get all those employees of that organization, and you might try to enroll 10, 15, 20, 100 people. So this is very important, not only from the perspective of you making sure that you present the right program for them. And again, as we mentioned last week, this could be something where somebody will not accept the subsidy from the marketplace because they're getting the money from the employer. So that would be a situation for that. But aside from that, aside from you doing the right thing, is that you're running into an opportunity, because if they are offering that individual an HRA and it's 42 employees at that organization, you have 42 chances to enroll 42 in different families. Okay, so you can say, hey, could I go and talk to the owner or talk to somebody over there, and maybe I can get everybody in a room and I will present to them all their options and properly explain to them how this works, and I can help them select the proper plan for them. So again, this form is very important in terms of that, okay? So again, we have this form in the website, and it's also part of the presentation. So let me go back to the presentation here, and make sure that you download this form and that you start using it right away. Okay, so let's continue the process. Okay, so now let's talk about the enrollment. And I know that there has been a lot of confusion, and not only confusion, but a lot of people not feeling very good about the way they do it when they know what they're doing, and if they don't know what they're doing, running into certain risks because of lack of understanding of what is happening. But we basically have three different ways, three paths, and this is how CMS refers to this topic. three different paths to enrollment. And we have the marketplace pathway, which is the traditional way to enroll. And then we have what is called the enhanced direct enrollment, EDE pathway. The enhanced direct enrollment, the EDE pathway. And then we have the classic direct enrollment, the classic DE pathway. The classic direct enrollment, classic DE pathway. And these are three different ways on how to enroll. And remember that this is evolving, this is changing. So initially there were three different ways, and now they are developing certain characteristics where they're starting to look very similar one to the other. But I really need you to understand the different ways, because you have to make a decision. And you need to understand about this in order for you to make sure that you're doing the right decision, and that you are not losing business because of making the wrong decision. So one important thing that you need to understand is that with the classic DE and the EDE pathways, you do not require consumers to log into their healthcare.gov account. So you have the marketplace, okay? And with certain ways to enroll, they don't have to go there, because they go through the back door, okay? Everybody ends up going there, but some people have to go formally, and other people can go through the platform that they're using. And another thing that is very important is that the direct enrollment, the DE and the EDE, are the ways for you where you can assist consumers over the phone. And remember, part of what we want to do is we want to make sure that we help people as much as possible over the phone. So you need to make sure that you understand these ways to do it, so that you do it right now. What we have been using, what we started using from day one, was the traditional way, the marketplace pathway, which was we would go to healthcare.gov, we were with the client next to us, okay, we were sitting with them, or we were doing it on the phone or whatever, and we would basically create an account at the marketplace for them, and we would know their username and the password. And CMS has said and repeats it all the time, you cannot be doing that. You should not be going into the marketplace with the client's username and password as if you were them, unless obviously you are with them, or you have a written, very formal authorization, basically a power of attorney, okay, that where they allow you to do that. And I know that many agents do not have a formal power of attorney from the client telling them that they can represent them on their behalf in the marketplace. So again, if you want to do the traditional marketplace pathway, make sure you're doing it right. Make sure you have a document, a legal document that authorizes you to do so. Because if not, you are doing something that is not compliant, okay? When you are going in there, even if the client might know that you're doing that, if you are doing it, you are doing something that is not correct, and you can end up in trouble for that. So again, that's the traditional way to do it. Then we have the classic direct enrollment, the classic DE pathway. And basically the way this works is that it begins on a private website. So you go to some type of private website, and you start the process there, and then that private website takes you to the healthcare.gov website, where you submit the application and where you receive the eligibility determination. That's the important thing. Where does the eligibility determination takes place? When you do a classic DE pathway, you start at some website, and by the way, I'm going to show you, that's what we're using right now. You start at a private website, you start at your landing page or at your e-commerce stores like we do, and then you take the client to healthcare.gov, you submit, you enter the information, the information is taken by healthcare.gov, and they are the ones that provide the eligibility determination. Once the eligibility determination is made, then there is a redirect back to the private website to complete the enrollment. And there is an option where people can stay over there in the marketplace and make the enrollment over there in the marketplace. In that case, you need to make sure that your information is entered properly so that you get due credit for the enrollment. Okay, so you have to be careful with that. Now, there are different classic DE pathway providers. Some of them, basically, they are known inside the system as web brokers, And one of them, for example, is Quoted Corporation, and you have Benefit Align, and we have INX Cloud, and we have TFA Benefits. This one is just in a couple of states, so this one is not at a national level. We use two of them. We use Quoted Corporation, and we use Benefit Align. And the reason for that is because we're always comparing to see what each one is doing and which one is better. And they're very similar. Now, one of the things that is happening with these DE pathway providers is the fact that they're beefing up their package. And then it's not only does it provide the capacity for you to enroll somebody in the marketplace, but at the same time, it becomes a CRM system where you have lead generation and you can keep the client's information and you can do a lot of different things with it. And that changes the pricing associated with them. But today, okay, the way we work with them, if you, with Quoted Corporation, the basic package, they give you the CRM system, and it's around $150 a month. It will cost you to have their platform. And with Benefit Align, which is, again, as I mentioned before, we use them both. Basically, if you pay on a monthly basis, it's normally $75. But I spoke with them, and if you, basically, if you pay on a monthly basis, it's $75 per month. But if you pay yearly in advance, it's $50 a month. But they agreed to accept that for anybody that enrolls within our organization, that they will allow them to pay the $50 per month. So you don't have to pay the $50 per month in upfront, but you can pay on a monthly basis, but you need to commit to a 12-month contract with them. That will be the case with Benefit Align. Quoted Corporation, again, is a little bit more expensive, but on the other side, again, the platform that they provide you with is more robust. For example, it gives you the capacity, if you generate leads, you could sell the leads to the system. So again, it gets really sophisticated. But this is very important because when we touch on digital marketing, these are some of the tools that we use for digital marketing. So this is something that you really need to consider and make part of your business, because again, you can take one of these quote engines and really dress them up inside some type of platform that you create, that we help you create, by the way, and you can really do a lot of different things with them. By the way, many of these platforms do business both for Medicare and for ACA. So you have in one platform both enrollment capabilities. Okay, so very important that you understand this. I haven't used INX Cloud, but I do know about them, and I know that they're also really good. So again, what I need you to understand is the fact that you want to use a web broker, and traditionally the way this works is you start at some type of private website, then you go to the marketplace and you receive eligibility at the marketplace, and then you can come back and complete the application on this side, or you can complete the application at the marketplace. Now, the danger about completing the application in the marketplace is the fact that if the guy sees there's some plan that you don't represent, they might want to end up buying something where you're not going to get a commission. Now, we solve that issue by making sure that we're contracted with all the carriers that are in your market. That way, whatever they decide on, you can make a commission on that. That's one way to solve the issue about the fact that they are presented with all options, and you want to make sure that you represent all plans. And that is not easy because, again, as the market matures, you have more and more companies, and then it's more work for you. But that's one way for you to solve the problem if you enroll in the DE pathway. I'm going to complete this next couple of slides and then come back here because I want to show you the actual platform, how it looks. Okay, and this is the actual classic DE pathway that we use with Quoted. And again, as you see here, once you enter the information, it will redirect you. It will redirect you. Here it is where it says visit the exchange marketplace by clicking on click eligibility link. Okay, so this is how you click here. and it takes you to the marketplace, and then you check for eligibility, and then you can come back and complete the plan here, or you can complete the plan over there at the healthcare.gov website. Both Quoted and Benefit Align, which is the two providers that we use, at this time as we speak, are in the final stages of converting this classic DE into EDEs, where basically everything is done in the same place. That's going to really expedite things and take some confusion out of the process. Supposedly, they're just waiting for final approval, both of them. So that I would say that starting next year, the classic DE is going to basically disappear. And the only thing we're going to be left with is the enhanced direct enrollment pathway, which is the pathway where the insurance or the insurance company or the provider or whoever it is, or the agent or the broker, gets together with the consumer and they complete, okay, all steps in the eligibility and enrollment process in a single website. So everything is done in one website. It doesn't look as it is going to healthcare.gov, but again, it's doing it in the back end. Okay, it's just that you don't see it in the process. So everybody's moving into this, and some of the examples of these providers, we have the actual carriers, and when the actual carrier is the one that provides you with that, the entity type is called the issuer. So if you see, for example, you see here issuer Centene, which is Ambetter, is the issuer. They do provide you with an EDE pathway. And then Molina also provides you with an EDE pathway. And then you have Community Health Choice that also provides you with an EDE pathway. But then you have Health Sherpa, which is a web broker, which provides you with an EDE pathway. Now, I haven't used a Health Sherpa in a long time. I had some issues with some agents having access to my clients and all that, so I decided to stop using Health Sherpa. I haven't used them in a long time because of that. By the way, some of these corporations do have a relationship with Health Sherpa, and then what they do is they incorporate Health Sherpa inside of their platform. And so you talk about Health Sherpa within Centene or Health Sherpa within Molina. That's one way to do it. But you can also talk about Health Sherpa itself. So you do have an account with Health Sherpa. And there is a difference there. You would have two username and two passwords, which are different. And a lot of agents get confused with that. Okay, so you need to make sure that you understand exactly what pathway is it that you are using. Are you using the Centene pathway or the Molina pathway, or are you using Health? Do you have an account with Health Sherpa and you're using Health Sherpa per se? Okay, so you need to make sure that you understand that difference. Now, one of the things that is good about these EDE pathways with the carriers is that you can manage the whole relationship with your client there. I mean, it gets into the arena of it being a CRM system. So it's really good about that, okay? It's really powerful and good about that. So, and normally they do have their plans there, so you can enroll in the actual platform, but there might be specific scenarios that their platform cannot manage. Situations when you start entering information, they take this type of situation and this type of situation and this type of situation, but they don't take other situations. They cannot handle certain situations that are complex. So when that happens, they will send you to healthcare.gov to complete the enrollment. So you might be in a situation where they tell you, no, for that, you need to go to healthcare.gov and do it over there because our platform does not have the capacity to manage that type of scenario. And by the way, with the course that you have been taking, and I know hundreds and hundreds of you have been taking the course, and I have been getting really good testimonials and comments on it. The course that we have on the platform, on our Amidin platform, the course that we're having on the healthcare.gov platform, on the Amidin platform, tells you about all these different complex scenarios that you might run into and how to handle them. So that is really good. Additionally, any issuer like Centene or Molina, they do have the products in their platforms, but obviously the plans are also available on the marketplace. So you can go through the marketplace, or you can go through the carrier directly and then just enroll somebody there. So again, 3 different types of ways to do it. Let me go back and let me just mention them again, because you need to make sure that you understand what you're doing here, and this is going to become even more important. We have the marketplace pathway, which is when the individual supposedly goes by himself or herself and enrolls, and many instances you, the agent, are with them and help them do that. And then you have the classic DE and the enhanced direct enrollment. Now let me go into the classic direct enrollment, classic DE pathway, which is the one that we're using. So let me go to our platform, and I'm going to show you. And here I'm getting a little bit into some of the topics on digital marketing that we do. So let me go and open one of these browsers here. And as you all know, for many of you that have been with us, we provide you, if you are with 5 carriers with us, we provide you with an e-commerce store, and that's your landing page. So let me just show you one of those landing pages. For example, this is how I set up my quote engine. I have my quote engine in my landing page, which is my name.wemasol.com. Okay, and this is my landing page here. And again, you can do digital marketing and redirect people to your landing page so that they enroll there by themselves or with your help, and they can even click here to join in a virtual in-person appointment so you can have a conference and all that. But anyway, what I want to do is that you go here to the health insurance tab here, and they click there and they land in the place where you have all the different carriers for health insurance. Okay, and I use 2 different brands here. I use the Premier Insurance Contracts brand and the Health Insurance Resource Center brand. Again, as I mentioned to you, we have Benefit Align and we have Quoted. So I use them. This is a special case because of the fact that I'm using both platforms. So let me go here into that, because I want to show you the Quoted platform. So I'm going to click on the Premier Insurance Contracts logo, and this is the actual quoting platform, the quoting engine. Okay, and again, this one is the one that costs $150 a month. Again, this is a very robust platform that has a lot of things with it. So I'm going to enter just any zip code. Let's go start talking about this. And I'm going to, how many people in the household remember the table that I show you? Let's do this simple. So I'm going to just say one person. And again, this is already taken into consideration the FPL table, so it already has the information. Again, we're still in 2020, but come November the 1st, you're going to see the numbers for 2021. So it's telling us that the maximum level of subsidy for a household of 1 is $49,960. So we're going to just say no here. Okay, so I'm going to say no here. Again, I'm saying no here. And then I'm going to select individual and family plans. By the way, this allows you to quote many other different types of products. Okay, for example, here you would do Medicare, and here you would do juveniles and etc. So you have a lot of different things here that I don't want to get into. And again, this is the quoted. And this information here, you can turn it on and off so that you require more or less information. For the sake of this exercise, what I do is I don't make anything required. Now, this is twofold, because if you allow people to just quote in your platform, with you capturing any information, you won't get any information. So you want to make sure you keep an equilibrium there in terms of what you want to capture or not. So I'm going to just make it easy here, and I'm going to just say one person. So I'm going to say if it's myself, and I'm going to enter some date here. And I'm going to say somebody that age, no spouse, nothing else. And again, one person in the household. I'm going to want, again, you can do off exchange, and you can do on exchange, and you can do short term, and you can do all different types of short term. So again, this is a very versatile platform that allows you for many different things. So I'm going to just say that this individual makes $20,000 a year. Okay, and I'm going to go click continue. Okay, so here we have the actual quote engine. Okay, now the first thing that I want you to recognize, here we're putting together many of the things we spoke about. The first thing is how much subsidy. Remember, we can help people in two different ways. We can help them with the monthly premium, and with the help, we can help them with cost sharing. So upfront, it tells you what is the monthly premium help. Remember, if they fall between 100% and 400% of FPL, you can help them with the monthly premiums. We saw that with the tables. And by the way, one thing that I strongly recommend you is that you download that table and that you print it and put it. If you have an office where people walk in, just put it in a wall, okay, or use it as a tablecloth or something where you use that table as part of the conversation. It's a fantastic way to start a conversation on all these elements here. And so it's telling you that the subsidy, based on the information that we provided, it's $468. So whatever he decides, he's getting $468 from the government to pay for it. It will tell you what level of cost sharing reduction he's entitled to based on the information that we provided. So now we know that he's at the 87%. Now remember, 87% of what? Of that maximum cost sharing limit that we presented in the slides. Okay, so it's 87% of that. And this is the information that we provided. Now, what I normally do immediately as soon as I get here is I scroll all the way down here. And I'm going to make this a little bit bigger here. And here, it's an incredible summary. Let me try to make it as big as possible, but that I don't lose anything. So it has a lot of good information, because it tells you, number one, it ratifies the information you provided. In this case, I said that the household income was $20,000. It's telling me what is the maximum of income that will qualify him for help. So it's 4.59%. Remember, when we were talking about those percentage numbers that are so important, okay, it will make it will keep track of that, and then it will tell you where do they fall in terms of the FPL. So this individual is at 160% of FPL. So it tells you where this individual is in the table. And it immediately tells you what level of subsidy they will be entitled to based on that. And then it will tell you if they would qualify for Medicaid or for CHIP or for subsidies or for cost sharing reduction. Obviously, this individual doesn't have any kids, so he will not qualify for CHIPs. And because of the level of income that he has, he will not qualify for Medicaid. So these platforms integrate the information with Medicaid and immediately tell you here, they give you a first look at what the situation is, okay? So that's the first thing I do. Then I go back up, and let me make it, I'm gonna leave it big here. Okay, so let me, by the way, if you hover over anything here, it's gonna give you a lot of information on everything. So let me make it a little bit smaller, because I want you to have a better view of all of these things here. So let's look at this first plan here. By the way, you can sort by different criteria. You can sort by company or by plan type or by cost. And I strongly recommend you that you learn how to sort things around, okay? So that you learn to compare everything. But let's look, in this case, I'm sorting by the actual estimated monthly premium. So that's what I use. But let's look at this. So the first, and by the way, the platform will tell you if you're contracted with that carrier or not. Now, you can set it up where it will show all carriers in the market, or you just show the ones you are contracted with. So you can set it up in such a way that it will not show any companies you are not contracted with. But if you decide that you want to show everything, it will tell you if you are contracted and ready to go with each one of those carriers or not. So this contracted means that I am contracted with Ambetter here. It will tell you the name of the carrier, the name of the product, very important. Okay, remember when we were talking about the products, okay, it will tell you what type of product it is. In this case, it's a silver plan, and it will tell you the type of network. It's an EPO. Very important that you understand those things. So it tells you some of the most important things that you really need to take into consideration when you are looking at a plan. Okay, remember, the only way you can really help them with cost sharing reductions is if you are presenting a silver plan. So if this is not a silver plan, you will not be able to help them with cost sharing reductions. So, and the way I have it set up, I always display first the silver plans, because I am going first with people that I am assuming that I can help as much as possible in the marketplace. That is the strategy behind what we're doing here. So it tells you the type of the type of product and the type of network right there. Then it tells you the overall rating. That's something that is not very much considered under the ACA. It's not a very important. It's not a doesn't have that much weight. Over 65 in the Medicare market, this overall rating is very important. It determines, it changes a lot of things. So that makes a big difference over there, over 65. But it's not as important. It is an issue, but it's not as important under the ACA plan. And then here we go. So in this case, this plan, okay, if I hover over it like this, it tells me that the actual plan cost. I cannot use the pointer because it's also a mouse, and so it changes things. But you see there on the screen that the actual cost of the plan is $532 a month. That's what the actual plan costs per month, $532. But remember that he has an estimated monthly subsidy of $468. So he is going to end up paying $64.53 per month. Now, you will see across the board the word estimated, because this is an estimate. Now, normally when you end up enrolling individuals, the number that they're going to run into eventually is very similar or exactly the same as the one you presented here. But always make sure you use the word estimated, 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 okay? So that's that part there. Now, remember when we talk about the cost structure of a health insurance plan and how it has 5 different cost elements? Well, guess what? All this part here is about the cost structure of a health insurance plan. So this is all the different rules and everything associated with how this product works. So it talks about the deductible, and it talks about the maximum out of pocket. So in this case, this product has a deductible of $1,950 and a maximum out of pocket of $1,950. So they're exactly the same. The primary care visit is there is no charge for that. The specialist visit is $5. Urgent care $10. Inpatient hospital, no charge after deductible. Generic drugs, no charge. So that would be $0 for generic drugs, and then preferred brand drugs, $25. What I want to emphasize, by the way, I don't want you to memorize or put your mind into this number here, because they're changing by in 2 weeks. You're going to have new numbers, okay? And again, you have many products with many different characteristics, so I don't want you to get into the actual number. What I want you to understand is that you do have a estimated premium that is. Always make sure that you talk to them about what the actual cost is, the $532, because if you tell them that it's $64, they might infer that you are getting them into a lousy program, a cheap program. And that is not the case. This is a very expensive plan that is full of benefits, but he's getting, because of your work and your process, $400 and something in subsidies, and therefore he's going to pay $64. And then we go through the fact that he needs to present his taxes and all the whole thing there. Then you have even more information here: the plan details, the view similar plans, find doctors, and one exercise that you can do. Well, on the left-hand side here, you can narrow your results by tiers, or by deductible ranges, or by plan type, how many HMOs, how many EPOs, or by price range, or by the brand. Or you can say, okay, just show me the Molina plans, or just show me the Oscar plans, or just show me this, or just show me that. And then by rating, okay, by rating also, again, this is not such an important issue in this market, but you could do that, okay? Another thing that you can do, which is really good, is you can click here on, let me compare this plan. Let me move a little bit down the table here with this plan here. And I'm going to compare with this one here. Okay, so I'm going to compare the plans and I'm going to click compare. And now I get this table here. This is really good because you can email this to people. So this is something that you should be doing all year, saying, hey, once annual enrollment comes in, let's look at different options. What I want you to do is I want you to understand the fact that you need to compare. You need to make an evaluation of what is it that you have, and we need to explore different possibilities. Okay, and this is one way for you to have a conversation with these individuals over the year. So this, and then this is something you can email to people, you can send them for them to enroll, etc. So you can do many different things here. So again, this will tell you, let's look at what is a premium. Again, one of the issues about this is that this becomes, remember what I told you when we talked about the cost structure, the first one is the premium, and that's the one that most people look at, and that is not right, okay? Because, a lot of people might go with this $64 here, and maybe the $180 a month plan is way better. I'm not saying that. I'm saying that that could be the case. Okay. So again, make sure that that you understand the cost structure and that you go through everything here. Now, the thing that you need to understand is all these variables here on the left-hand side here are important. So these are the actual elements in the plan. Okay. So I'm going to go down. You have the emergency rooms and the home health care. And in the last session, and that will be the week before annual enrollment, we're going to actually go through certain plans. I'm waiting as much as possible to have as much information as possible. So we will do that evaluation, and we're going to compare, and we're going to spend 1 hour just looking at plans and moving around the plans and bringing back some of the concepts that we have been looking at in these presentations. And we're going to round up everything and make sure that you are ready to go. So at this point, I don't want you to focus very much on the numbers here, but on the actual concepts and what are the things that you need to take into consideration. So again, as we mentioned, they all have maternity care, and these are the characteristics for maternity care, okay? And this is how these plans work. Now, in terms of the actual presentation, what I want you to understand is this. This is what I need you to start understanding from everything that we're doing. And this is the optic that I want you to have when you start looking at those plans. What is the cash flow structure of the plan? Is it this type here? This type? This is how the money goes out of the individual's pocket? Or is it of this format? Okay? Where you have a lot of things outside of the deductible. Okay, you have a lot of things outside of the deductibles. And when you have things outside of the deductible, that smooths the cash flow much more. Now, this was very difficult to implement at the beginning by the carriers because you need to keep track of everything, and it's more complicated. And to price it is even complicated because I used to have conversations with them about this model. In fact, when I presented this little graph to some executive of some of these plans 7, 8 years ago, some of them asked me that if I authorized them for them to use this graph when they were talking to their executive and they were talking about the design of the plans. And I gave them an authorization to do that. Okay, so this is a very fundamental element, and this changes a lot of things because let me tell you, if you have this type of plan here, and in fact, the first one that we saw with Unbetter had this structure where you had a deductible of what, $1,950, and the maximum of out-of-pocket was also $1,950. So what that means is that an individual basically doesn't have any type, they're paying their monthly premium, and they don't have any type of coverage until they reach their deductible, which in that case was almost $2,000. Well, guess what? Since the individual here has to pay for a lot of things, in many instances, they end up not going to the doctor and waiting for the situation to get out of their hands, and then they end up in the emergency room. So that is one of the consequences of this type of plans. Now, on the other side, these type of plans, they do present a lower monthly premium. Okay, so they look more attractive, but when they start using them and they start getting hit with all those, with the fact that they have to pay a lot of money here, then in many instances, if they have lower resources, they will end up not using the system, and that's exactly what we don't want. We want people to start using the system a lot. So we want this cost structure, okay, this cash flow process, okay, and you will get that when the plan has a lot of items outside or before the deductible. So, and that's something that we're going to again look at in the last session. So let me just do something here because we are running out of time, and let me just make sure that we go over. So we ended up with the platform. Then we're going to talk about the enrollments. Let me just show you something here. The homework. Okay, I want to make sure that by now you should have registered with Help on Demand. You should already be registered with Help on Demand. If not, go back to the previous presentations and look exactly how you do that. But you should be registered with Help on Demand by now. By now, you should have completed the AMIDIM Selling in the Healthcare.gov Marketplace course. That is basically, we have 15 videos, short videos there. Some of them are 2-3 minutes, other ones are a little bit longer, but they cover many different scenarios. You need to make sure that you can understand and process all the different situations that you're going to run into, and that we give you that training with the AMIDIM, which is the American Institute of Digital Marketing course called Selling in the Healthcare.gov. It's at no cost to you, so I strongly recommend you do that. You should by now be properly registered with CMS, and you should be ready to go. So you should have your obviously your insurance license up to date. You should have your CMS certificate up to date. You should have completed that. You should have all your contract in place by now. Don't wait until the last moment to get contracted with other carriers. If there is another carrier coming in, make sure you get contracted. There is another one coming in called Friday. It's very important that you get contracted with Friday because we don't know who's going to be who. It might be something that it might not have any transcendence in this market, or it might be a player. We don't know at this time. So you don't want to be left out, and you don't want to start running at the last moment to trying to get contracted with somebody because you played the situation wrong. So call the contracting department with Sandra Lizarraga and make sure you get contracted with all the carriers, so that you don't have any issues with that. And then hopefully by now you should check that all your registrations are complete. CMS has put together, and that's the address there, a fantastic place. And in fact, we also have it at the Prinsuco website, where you can go there and you can see exactly where you are with all your training and everything associated with the process for you. Okay, so we're gonna leave it here. Next week, we're gonna talk a little bit about digital marketing, and again, we're gonna see how we connect digital marketing with the quoting engines. And we will make sure that we wrap up everything and get ready for the last session, where we're going to be having the actual products, hopefully, that we can see them and look at the numbers for 2021. Again, everybody, thank you very much for your participation in this training. I hope the training has been good for you. Remember to go to our platforms and look at all these trainings. We have all the recordings. We're putting it together in one of the packages, in one of the courses, for you to be able to see everything. Make sure you follow up on your homework. Make sure you do everything that you need to do so that you can enroll a lot of people this year and you can make a lot of money in helping a lot of people. Again, everybody, thank you very much for your participation in the training. Have a nice day.